Yeah, just like we've spoken about, planning for menopause before you actually arrive at menopause, planning for conception before you're actually pregnant. Yep, that's important. So talking about, contraception a bit, if we circle back and kind of look at the opposite side of the spectrum, so conception, there's a lot of questions about fertility out there. What is a woman's window of fertility? I put out some information here recently looking at, PCOS and the fact that they actually have, on average, a slightly extended window of fertility. So just because someone has, some downsides from a condition that they have, it doesn't mean that there necessarily aren't upsides to that. But one of the things that women can do is check a AMH, anti-Müllerian hormone, and we'll have this up on our website where people can purchase this, go to LabCorp and get the blood draw and kind of plot themselves on their reproductive timeline and see where they're at. Now, do we know if this is going to be relevant in 5 or 10 years? Hopefully by then there's a way to extend the reproductive timeline that we can slow ovarian aging, as the ovaries seem to age faster than other organs of the body. There's some other things that women could consider checking in addition to the AMH, but if you're looking at what's the most bang for your buck in terms of like putting yourself on that timeline, the AMH is probably the way to do so.
Nope. And as we've mentioned, things like taking oral contraceptives or being on hormone replacement can affect AMH, or even having an IUD can affect AMH. Anti-Müllerian hormone is very important in embryological development. The Müllerian duct is the duct that kind of that is not inhibited in males, so it forms the male genitourinary tract, whereas in females it forms female genitourinary organs. So as your AMH is dropping, many other things change. It's still important to track your cycles and consider using tools like LH, finding your LH spike, or even basal body temperature, maybe cervical mucus monitoring, but also considering workups like antral follicle counts and like with your doctor, and things like day 3 ratios of FSH to LH and estradiol. So there's a lot of other things to consider other than just AMH, but providing these tests on our website is part of our goal to improve public health and public access to not only information on the podcast, but also things that can become clinically significant, so that you do not have to wait until desiring fertility, so that you're being more preventive rather than reactive.
Yeah, just like we've spoken about, planning for menopause before you actually arrive at menopause, planning for conception before you're actually pregnant. That's important. And then also seeing where you are on the timeline of, your reproductive window is also equally as important. So I think it's important to sort of provide this information to people, because there's not a lot of great sources out there. And we'll go through later on some ways to, potentially look at some of the downsides and decrease those risks for those downsides for women that are taking oral contraceptives.